the topic today, which is one of the very common diseases, but the approach for this disease, which is hypertension. I will do my best just to summarize in 30 minutes how to approach for hypertensive patients. All of us, we know very simple, the hypertension is about two readings, one systolic and one diastolic. Okay? All of us, we know the systolic means this is during the cardiovascular contraction, during the heart contraction, and the diastolic due to relaxation. Okay? So we have systolic and we have diastolic, the above reading and the down reading. The first three questions, just it will be all the objectives of our lecture today. The first one, a blood pressure greater than 140/90 is considered high. That's true or false? Borderline. According to the age. So the statement itself, this one or this question, true or false? What you'll choose?
True.
True? False. True, false. Okay. So it's divided. No, any reading above systolic above 140, diastolic above 90, it is a high reading. Let's agree for that. As a reading. But we cannot label this patient hypertensive. But the reading itself, it's high. Above 140 or above 90 diastolic, the reading is high. That's why this statement is true. Second one, you can usually tell if your blood pressure is high that you are feeling. What's this meaning? If my blood pressure is high, if my blood pressure now is high, I can feel some symptoms.
Yes.
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 Headache.
So usually when our blood pressure is high, the patient, he will symptomatic, he will feel like headache, dizziness, he will feel
Shortness of breath,
short of breath, something like that. So you mean all hypertensive patients are symptomatic?
Asymptomatic also there.
Asymptomatic also there. What's common? Asymptomatic or symptomatic?
Symptomatic.
Symptomatic. This is common. Okay. And this is very important. If this message conveyed to you, most of hypertensive patients are asymptomatic, no symptoms. Okay? Most of hypertensive patients, whatever the reading, usually are asymptomatic, no symptoms. Most of us, we have, once the blood pressure became high, we feel headache. No. The severe headache, yes, it can only occur if there is a hemorrhagic stroke, something related to the brain. But the usual headache is not related to hypertension. All of us from doctor side, from nursing side, if I feel headache, check your blood pressure. Is that correct? No. Because the headache, there is lot of causes for headache. But hypertension per se not leads to headache. Okay? If the blood pressure is high, I can feel some symptom? No. Because usually hypertensive patients are asymptomatic, no symptoms. And that's why blood pressure is known as silent killer. Okay? So it is false. Third one, if the blood pressure is elevated above systolic 140 and the diastolic above 90, am hypertensive? Any one of us, if we check the blood pressure for any one of us now, and it came 160/100, he or she is hypertensive?
In one reading,
In one
we
of us.
cannot.
If you check my blood pressure down, I am now 170/100. I am hypertensive?
No, doctor, one reading we cannot say it is.
One reading we cannot say. Very good. So in one reading, so one reading of high blood pressure, we cannot consider this patient hypertensive. Okay? Let's agree for these issues. I'm coming for these slides later on. So how to diagnose hypertension? For reading, according to the number. The number itself, yes, it means something is wrong going for the patient. But we should take the patient from up down, not only the number, not only the reading. Okay? for diagnosis of hypertension, according to the international guidelines, lot of international guidelines, the most important one, which is the JNC, Joint National Commission, number 8. This is the latest one in 2016. And European and American Societies for Hypertension, they divide the blood pressure according to the reading into 4 stages. 4 stages. The stage 1, the stage 1 is the normal person. For any normal person, the systolic should be below 120 and the diastolic below 80. So any normal person, systolic should be below 120 and diastolic below 80. For pre-hypertensive patient, systolic it will be from 120 up to 140, and diastolic above from 80 to 90. So this reading, we call it this pre-hypertensive. Okay. The hypertensive is stage 1. Patient hypertensive is stage 1, from 140 to 160 systolic, and the diastolic it will be from 90 up to 99. This is stage 1 hypertensive.
Responsible for the newest innovation of Novo Nordisk, a product called Rybelsus. It's an oral semaglutide. I will not make it very long, just 3 to 5 minutes. Let's imagine a patient is having a meal, and this meal reaches the intestine. The intestine will release a peptides called incretins. This incretins is 2 peptides, GLP-1 and GIP. The majority of this peptides is the GLP-1. What its role? Just a messenger to the pancreas to release insulin so that the glucose to be stored in the cells and to be used by muscles and so on. This is for the normal patient. If this patient is type 2 diabetes, he might have a malfunction in the function of this incretins. That's why we need an external GLP-1 receptor agonist to do the same role of the normal GLP-1 of any patient. Okay. Currently, we have multiple molecules on the same class as GLP-1, like liraglutide. I think you all may know Victoza. Dulaglutide, it's Trulicity. And currently, we have a new molecule called semaglutide, and it has 2 forms.
Injection?
Yes. First one is injection and called Ozempic. It will be once weekly, and it's not released in Kuwait yet. And the other one is oral semaglutide, and it's the only and the first oral GLP-1 worldwide. And this is what we are talking about today, which is Rybelsus. Let's see the comparison between Rybelsus and other anti-diabetic medications. Look in the middle page. You will find 2 comparisons. One versus sitagliptin, which is the DPP-4 class. You will find that Rybelsus achieved 57 more HbA1c reduction than sitagliptin, and when compared